Hi, my name is Miss Burns. Today I'm here to talk about special education, more specifically disabilities and the disability categories. First disability I'm going to talk about is autism. Autism is a disorder that appears in early childhood, usually before the age of 3. Symptoms vary and so does the severity. All of the autism spectrum disorders affect a child's ability to communicate and interact with others, and there's no cure for autism, but intensive early treatment can make a big difference in the lives of children with this disorder. Some of the characteristics of autism are communication problems, so difficulty relating to people, objects, and events. These children usually play with toys and other objects by themselves, or unusually. Difficulty with changes in routine or familiar surroundings, repetitive body movements or behavior problems. The next disability category is deafness. So this is a hearing impairment that's so severe that these children or adults can't hear anything, or can't hear, or they're hard of hearing even when they have amplification provided by hearing aids. The next disability category is deaf blindness, and this is a hearing impairment and a visual impairment that occur at the same time. This makes communication and education difficult, and these students can't be served in just a classroom for students that are deaf or just a classroom with students that are blind. The fourth disability category is hearing impairment. This is an impairment of hearing that can be permanent or changing, and it can have an effect on a child's education. The next one is mental disabilities. Another term for this is a cognitive disability. These terms are used when a person has certain limitations in mental functioning and in skills such as communicating and taking care of him or herself, and social skills. These limitations will cause a child to learn and develop more slowly than typical children. These children may take longer to learn to speak or walk and take care of personal needs such as dressing or eating. Children with mental disabilities may have trouble learning in school, but it's important to remember that they will learn. It just takes them longer, and then there are some things that they just won't be able to learn. Multiple disabilities. Children with multiple disabilities, they have more than one disability at a time. So an example would be a child that has mental challenges and is also blind. So the combination of the disabilities causes severe educational challenges, and the child may not be able to be served in a regular special education classroom for only one of the disabilities. Orthopedic impairment is a severe orthopedic impairment that has a negative effect on the child's educational performance. Orthopedic impairments can be things like a clubfoot, absence of a limb, bone tuberculosis, cerebral palsy, amputations or fractures, or burns that cause contractures, and a contracture is loss of joint movement. Other health impairments, having limited strength and vitality or alertness due to recurring or severe health problems. Some of these conditions could be a heart condition, tuberculosis, asthma, sickle cell anemia, hemophilia, epilepsy, leukemia, or diabetes. These conditions can have a negative effect on the child's educational performance. Tourette syndrome is a neurological disorder that includes repetitive involuntary movements or tics. The average age of onset for Tourette syndrome is 7 to 10 years old. Vocal tics can be sniffing, snorting, barking, or sometimes repeated words. An example of an involuntary movement would be some people with Tourette's cause themselves self-harm. An example would be someone that punches themselves in the stomach. And then also with Tourette's, the more excitement there is, the worse the tics are going to be. Emotional disturbance is a condition where one or more of the following characteristics are present over a long amount of time and to a certain degree, and has negatively affects a child's educational performance. So these characteristics include an inability to learn that cannot be explained by other factors, inability to form and keep relationships with others, inappropriate behavior or feelings under normal circumstances, general consistent mood of unhappiness or depression, tendency to develop physical symptoms of fear associated with personal or school problems, and this also includes students or children who have schizophrenia. The next disability category is specific learning disabilities, and this is a disorder in one or more of the basic processes involved in understanding or using language, spoken or written. They may show up in an imperfect ability to listen, think, speak, read, write, spell, or do mathematical calculations. This term includes some conditions such as brain injury, minimal brain dysfunction, dyslexia, which is a reading disability in which students have difficulty reading. Some clues to learning disabilities. The student may have trouble using the alphabet, rhyming words, or connecting letters to their sounds. May have many mistakes may make many mistakes when reading aloud and repeat and pause often. May not understand what he or she needs. May have real trouble with spelling. May have very messy handwriting and hold a pencil awkwardly. May struggle to express ideas in writing. May learn language late and have limited vocabulary. May have trouble remembering the sound that a letter makes or hearing slight differences between words. May have trouble understanding jokes, comic strips, and sarcasm. May have trouble following directions. May mispronounce words or use the wrong word that sounds familiar. May have trouble organizing what he or she wants to say, or is not able to think of the word that he or she needs for writing or in conversation. And they may follow the social rules of conversation may not follow social rules of conversation such as taking turns, and may stand too close to listener, may confuse math symbols and misread numbers, may not be able to retell a story in order, meaning may not be able to tell a story from the beginning, the middle, and the end, may not know when to begin a task or how to go on from there. The next disability category is speech-language impairments. This is a communication disorder. It can be stuttering, impaired articulation, so impaired speech, a language impairment, or a voice impairment that adversely affects a child's educational performance. Traumatic brain injury is an injury to the brain that was caused by an external force. This kind of injury can affect how a person acts, moves, and thinks. It can change how a student learns and how they act in school. This term is used for head injuries that cause changes in one or more areas, such as thinking and reasoning, understanding words, remembering things, paying attention, solving problems, thinking abstractly, talking, behaving, walking, and other physical activities, seeing and or hearing, and learning. Visual impairment. Excuse me. The visual impairment has a negative effect on a child's learning, even with correction. This disability category does include blindness, and it includes those with some or partial sight and those who are completely blind. There are 4 divisions of visual impairment. The first is partially sighted. Partially sighted means that some of the vision problem that has resulted it's some sort of vision problem that has resulted in the need for special education. Low vision means severe vision impairment. The term applies to all individuals whose sight who are unable to read the newspaper at a normal viewing distance, even with the assistance of eyeglasses or contacts. And they use a combination of vision and other senses to learn, although they may require adaptations in lighting or size of print and sometimes braille. Legally blind indicates that the person has less than 20/2000 vision in the better eye or little to limited field of vision, and totally blind students learn via braille or other non-visual media. And pervasive developmental disorders. This is a delay in social, language, motor, and or cognitive development. The child may have social development delays and delays in one or more areas, in one or more other categories. And if you need to go back to any of this, it's also, all my information is written down on my website. If you have any questions, be sure to ask. We're here to help you out and answer all of your questions.